Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, my name is Friska Adinda Putri. I come from Aceh Tamiang. I am a psychology student at University of Malikusaleh. Okay. Here I want to explain the material about suicide. Okay, let's get straight to material. Okay, the first is a definition. Suicide is the act of intentionally taking one's life. This definition, however, has been expanded to describe the range of thought and behavior that are exhibited by individuals who are in some manner considering suicide. Suicidal ideation involves having thought of killing oneself or being dead. Suicidal intent involves having a plan for how to kill oneself and intending to carry the plan out. Suicidal behavior is a broad term that includes all action related to suicide, but also includes some behavior not captured by the other term listed here, including action related to suicide that did not result in an attempt, such as gathering bottles of pills or tying a noose. A suicide attempt occurs when an individual intends to take his or her own life, act on that intent, but does not die. A suicide completion occurs when an individual intends to take his or her own life and dies as a result. One way to understand suicidal behavior is to think of it as a continuum, with ideation at the far left and completion to the far right. In this way, behavior toward the left of the continuum are relatively less severe and behavior to the right are relatively more severe because of their differing proximity to suicide completion. Okay, next, importance and context. Suicide is a serious health problem worldwide, including in the United States. In 2002, it is estimated that 31,655 individuals died by suicide. 11 leading causes of death. Although rate varies somewhat year to year, approximately 30,000 people in the United States and almost a million people die by suicide each year worldwide. On one hand, 30,000 US deaths per year, one every 18 minutes or so, is a lot. On the other hand, suicide is a rare cause of death compared with other causes of death in the United States. For example, given that a person has died, the chance that the cause was heart disease or cancer is 52%. Given that someone has died, the chance that the cause of death was suicide is a little over 1%. However, the number of deaths by suicide, though an accurate representation of the fact that death by suicide is rare, also greatly underestimates the magnitude of the problem. For every death by suicide, there are as many as 25 non-fatal attempts. Suicidal ideation is even more common than attempts. Estimates suggest that approximately of individuals in the United States will experience substantial suicidal ideation at some point in their lifetime. Those suicide completions are relatively rare in the United States, but attempts are more common and ideation is even more common. The prevalence of suicidal behavior differs for men and women. Males complete suicide more often than females do, but females attempt suicide more often than males do. More specifically, men are approximately 4 times more likely than are women to die by suicide. Women are approximately 3 times as likely as men to attempt suicide. Okay, next, measurement. Although attempts and completion can be investigated with medical record, The other the other aspect of suicidality suicidality cannot be measured in such a straightforward manner. One common one commonly used measure is the Beck suicide scale, a self-report measure with 21 questions. For each of the questions, respondent pick one of three statements that best describe how he or she has been feeling. Okay, next, theories of suicide. One of the most prominent theories of suicide is Edwin Seidman. His theory states that suicide results from the perception of unendurable psychological pain, which he calls psychiatry. Another researcher of suicide, Aaron Beck, theorizes that atau play a causal role in the development of suicidal behavior. This theory proposes that suicide results from cognition that involves hopeless belief that things will not get better in the future. Roy Baumeister proposed that suicide results from a desire to escape from painful self-awareness resulting from discrepancies between expectation and actual event. A more recent theory was proposed by Thomas Joyner. This theory states that suicide results from the combination of three factors: toward that belongingness, perceived burdensomeness, and an accurate ability to inner lethal self-injury. The last component of theory, accurate ability, involves that idea that it is difficult to overcome the most basic instincts of all self-preservation, and that individual acquire this capability through experience with painful and provocative events. Next, risk assessment. Suicide risk assessment is a process conducted by a mental health professional to determine if an individual is at risk for engaging in suicidal behavior. Two main questions guide suicide risk assessment. Is the individual being assessed a danger to himself or herself, and is the danger but immediate and severe? The answer to this question can come from the use of standardized assessment measures, as well as clinical interview. A thorough risk assessment for suicide gathers information from the individual on both present suicidal symptoms as well as past suicidal behavior, current stressor, and other psychological symptoms. Next, warning sign. Members of the American Association of Suicidology are researchers and clinical who research and treat suicidal behavior. This group devised a list of warning signs for suicide that indicate severe and immediate risk for suicide. These warning signs are designated for the friends, family members, and any other people who may come into contact with a suicidal individual. The warning sign instructs that a person should get help immediately if he or she witnesses, hears, or sees any one or more of the following. 1. Someone threatening to hurt or kill himself or herself. 2. Someone looking for ways to kill himself or herself by seeking access to pill, weapons, and other means. 3. Someone talking or writing about death, dying, or suicide. Next, the warning sign also instructs that should seek immediate help if one witness, heard, or sees someone exhibiting any one more of the following: 1. Hopelessness. 2. Rage, anger, seeking revenge. 3. Acting recklessly or engaging in risky activities. 4. Failing therapy. 5. Increasing alcohol or drug use. 6. Withdrawing from friends, family, or society. Next, anxiety, agitation, unable to sleep or sleeping all the time. 1. Dramatic change in mood. 2. No reason for living. And 3. No sense of purpose in life. Okay, thank you guys.